On your patient, Mr. Hedding here. This is Matthias Hedding. He's a 62-year-old male, patient of Dr. Buss. He had an admitting diagnosis of a wound infection on his right foot and heel.
Wound infection?
Yes.
Right foot?
And heel.
And his code status is?
And his code status is full.
And allergies?
And allergies, he has an allergy to iodine. His history is type 2 diabetes and heart failure. And he just came back from the PACU, had a wound debridement, temperature 97.2, pulse 92, respirations 22, blood pressure 142/94, and he's on O2 at 2 liters by nasal cannula.
Well, I'm sorry, what was that blood pressure over?
142/94.
And 2 liters nasal cannula?
Yes.
Wound debridement?
And wound debridement. His pain is a 7 out of 10. He refused pain medicine in the PACU. He's apparently afraid of becoming an addict. So he's rather anxious right now. Prior to going into surgery, his blood glucose was 170, and it was treated with 1 unit of insulin per sliding scale. Hasn't been checked since surgery.
170 glucose?
And 170, and then he was given insulin 1 unit with the sliding scale. He has a dressing to his right foot and heel. The dressing is clean, dry, and intact. He is currently alert and oriented. Heart rate is regular. I do hear crackles bilaterally. No nausea, vomiting, but he has not voided since returning from the PACU. So preoperatively, he was able to ambulate but had an impaired gait and required assistance. His next blood glucose level is due before dinner. Pre-op labs were done yesterday and this morning. The only thing significant is he had an elevated WBC, elevated SED rate, and an elevated A1C, hemoglobin A1C. I haven't done vitals. I did settle him in. He said he's comfortable, but he, like I said, he's experiencing a pain 7 out of 10. His cousin James is in the room and is supportive. Okay. Any questions?
Has he had a bowel movement yet?
No, he hasn't.
I don't know.
You said he hasn't avoided since he came back from the PACU?
Correct.
Right, okay. Hereditary.
Does he have?
Oh.
Okay, so no Foley then. Right.
No Foley. Mm-mm.
And an IV?
Oh, I'm sorry. He does have an IV. He's got normal saline in the right arm. 20 gauge angio.
Right, like forearm or just?
In the right antecubital.
Okay. Right arm normal saline, 20 gauge.
Yes.
And all the meds and stuff we find in there?
Correct.
Okay. Elevated white blood cell, elevated head, elevated A1C. 2 liters nasal cannula.
So I'm going to go off duty now, unless you have any more questions.
Oh yeah, is his O2 stats? I don't think I got that.
His O2 stat is 93%.
Okay. 92 respirations. Okay. I guess that's everything, right?
All right,
Unless
yeah.
you...
Have a good shift. Have a good shift.
Thank you.
Bye-bye.
Should I continue?
Okay, we start all over now? Or we come in?
Yeah. Yeah. Yep.
Wait, we have to give her a chance to get there.
Oh, I'll make sure to gel in.
I ain't doing it before when she sees us do it.
I know. Let's go put her right there.
Hello? Hi, my name's Ernie. I'm going to be your nurse today.
Hi, Matthias. My name is Prianka. I'll be helping Ernie out.
Okay, bye.
How are you feeling today?
I have an awful pain in my foot where I had the operation.
Okay, yeah, you just had a debridement of that wound. So that's to be expected. Can you rate your pain for me from 0 to 10?
I'm also just going to check your armband here, make sure we got the
I'm
right
gonna come
guy.
in the room, you guys.
Just make me know.
What?
I don't know.
Did we fuck up already? No. Where's this close?
We didn't ask how the rate and watch.
Sorry about that, because I could not hear out there.
Oh, okay.
Okay. So yes, I'm Matthias, and you asked me how I am. I have an awful pain in my foot. It's constant, it's throbbing. What can we do about the pain? I just feel so tense, and it's hard to even take a deep breath because it hurts.
Well, I believe on your med orders, we have a order for morphine. You could take care of that.
I'm afraid to take morphine. I had a dose in the emergency department, and it really helped, but I don't want to be addicted. I had a friend who was an addict, and it was terrible.
Okay.
I understand. We will try to reposition you. I'll put pillows under your ankles to see if the pain subsides at all. But can you rate your pain for me right now out of 0 to 10?
It's about a 9.
About a
Hurts pretty
9.
bad.
Okay, well, getting addicted to morphine is, it takes a long-term, well, not long-term, but I don't think you're going to get addicted using it once for actual pain.
But I'm the cousin James.
Mm-hmm.
Why is he in so much pain? Why do you ask him to rate his pain on a scale? Is the anesthesia wearing off? Is that why he's in pain?
Yes. He's in pain because he had the debridement on his right foot.
But I don't know if he should take morphine. Aren't there side effects?
There are side effects of decreased respiration, drowsiness.
The most common are nausea, vomiting, and some GI upset.
Wow, I
But
don't know what to do
without-
now. That doesn't sound very good.
Well, there's side effects for every drug and narcotic, but to get you feeling better and healing better, we need to address your pain, or you're just gonna have a long, tough time in the hospital with the
Okay.
pain.
So,
We want to try to get your pain under control, especially because we want you to cough and deep breathe. That's super important right after surgery. You don't want your lungs to fill up with fluid, especially with the heart failure issue.
so you're saying if you give me morphine, that'll help me to cough and help me get better?
Exactly. And that's really key right now after
Okay.
surgery.
Okay, well,
So,
in that case, maybe I'll try it.
Okay. We'll try it one time and see how it works on your pain.
Okay.
Okay. I'm just assessing your IV right now, Matthews. It looks clean, dry, and intact. Your O2 is on. Are you having any shortness of breath right now?
Well, no, it's hard to take a deep breath because of the pain, but no shortness of breath.
Okay.
I'm gonna go ahead and raise up your bed, and then I'm gonna just take a look at the dressing on your right foot.
And while Ernie's doing that, I'll be just taking your vitals to make sure everything's,
Okay,
Alright.
and so is somebody gonna get me the morphine?
Yeah, I'll do that as soon as I'm done here.
Yes, you know what, while Ernie's
Unless you wanna
assessing
do
your
that.
wound, yeah, I'll get the medication going.
Thank you.
Yeah.
But now that I've decided to do that, we might as well proceed.
Yes. Hey. Don't see any drainage or redness or any kind of other fluid. Right foot to the right heel. Do you want to try to? Do you think we should try to elevate your foot as well?
Sure, I'll try anything. It really hurts right now.
There we go. 1 second.
Thank you. That does help, thanks.
I'll try to continue with your vitals.
What are you doing now?
I was trying to check your pulse, but I can't get one on that.
Okay. Oh, well, that can't be good.
No. Your pulse is 91. And let's take your blood pressure.
You may not be able to get that, Ernest. It's 141/94.
Sorry, what?
You may not be able to hear that. It's 191/94.
191/94.
Yes.
Okay. Is this up to the? Oh, okay.
Okay, Matthias, I'm back with your morphine. I'm gonna look at your badge one more time. Can you tell me your first and last name and date of birth?
Yes, it's Matthias Hedding. My date of birth is, as you see it on the bracelet.
Perfect. Thank you.
Thank you.
Alright, Matthias, so I'm actually gonna dilute the morphine.
Is there something for the pedal pulses that we're supposed to? This mannequin doesn't have it.
You can say that they're bilateral.
Okay. Bilateral +2.
I'll be diluting your morphine with saline, and then pushing it over 2 minutes. That way I can push it over 2 minutes and it's not as straight. I'm not just pumping morphine into
How
my
much
veins.
morphine are you giving me?
1 mil.
1 mil? Or how many milligrams of morphine are you giving me?
Oh, sorry, 2 milligrams.
Oh, okay.
You should take a listen to your chest.
Just clean it off the floor.
S1 and S2 in regular rate and rhythm. The pulse is just kind of high. And that's probably because of the pain.
Wait,
What?
do you have a question?
I do. I'm trying to put this in the flush right now.
Okay. So,
Can I just
Yep.
use the needle?
Is it alright if I sit you up so I can take a listen to your lungs? Or you want to stay lying down?
Yeah, I kind of want to stay lying down. If I may need some help, maybe that other nurse can help you lift me up
Okay.
when she comes back.
She should be back in a minute with her morphine. Can you squeeze my hands for me? Oh, good. Nice and strong.
So Priyanka, can you just show me the morphine and what you drew up, please? And just to double check.
Oh, yeah.
Thank you. So 2 mLs, and so you're giving 2 milligrams, 2 milligrams per ml. So you drew up.
Perfect.
So you drew up 0.5. So you're just giving 1.
I'm sorry. The 2 mils confused me. So I'm giving 1 mil.
1 mil. Okay, so that would be 2 milligrams.
Right.
So did you
2
draw up?
milligrams. Yes.
Did you draw up an entire
An
ml?
entire syringe of
Okay, perfect. Thank you.
Sorry.
That's okay. Thank you.
Okay. So I'll be, let me just push this morphine in and then I'll help you get repositioned.
Thank you. Yeah, I guess it's a good thing I'm going to take this because my foot really does hurt. But you promise I won't get addicted?
Correct. It's a one-time use and it's really needed again to help you with the breathing, to help you get rid of any possible fluid buildup in your lungs. We want to avoid anaphylaxis. We want to avoid pneumonia, especially with the heart failure.
So I can
Should
only
be
have
enough.
this once? Is that what you're saying?
No, it's as needed for pain, but
It's
I
as
know we
needed.
cannot promise you won't get addicted.
Right.
There's always a chance of that, but while you're here, we'll use it as needed.
Okay, well,
And as your pain, so
Right.
for example,
For pain.
as your pain subsides, if you tell us like you have a 3 out of 10, we would use lesser measures such as Tylenol,
Oh,
or ibuprofen.
okay.
Yeah, this is
We
for
won't be
severe
constantly
pain.
giving you morphine.
that makes me feel better. Thank you.
This is just because you have severe pain right now.
Okay. So you think my pain will be better tomorrow, maybe?
Correct.
Well, it's
That
gonna
is
be. This is an IV, so it's gonna be pretty rapid. You should start feeling better in like a minute or two.
Okay. Oh, wow, I do feel kind of, ooh,
That's the morphine.
ooh. Kind of feel happy.
Yeah?
Well, that's good.
Ooh, my pain's definitely better.
That was fast. All right.
Wow.
You want to reposition?
Yeah, let's go. We want to sit you up and have a listen to your lungs.
Okay.
And I'm going to assess his LSS is lower extremities while you do that. Right, heart and lungs.
I thought you were gonna help me lift him up.
Oh, okay, yeah. I didn't know what you were doing first. Okay.
Whee! Whoa, I feel a little dizzy.
Hang in there.
Take a deep breath in.
You guys better put me down.
Are you feeling dizzy?
Whoa. Okay, there.
Sorry about that.
You do have crackles bilaterally in your lungs.
What the heck are crackles?
Well, that's left over from your surgery. It's because you were on the ventilator and your stops the full expansion of the alveoli.
What are you
It's
talking about?
just the ventilator that you were on
What
And
is
they-
a ventilator?
when you had your surgery.
Oh my gosh.
It's mostly kind of normal.
So it's a very common surgical side effect after surgery is that, like I was talking about earlier, the reason we want you to cough and deep breathe is to expand your alveoli that are in your lungs and get rid of any possible fluid buildup. But when there is fluid buildup, it'll sound like crackles. So that's why we're hearing crackles, because you probably haven't been coughing and deep breathing because you've had a 9 out of 10 pain.
Oh, okay. All right, so we're almost
I
ready
did-
to stop the video here. Is there anything you want to close with? Anything you need to do? Did we don't?
Here's your call. We're gonna leave you with your call light and your. Yeah, did you scan it in? Right.
Okay, good enough. So Ellie, we'll just stop. She hear me?
Ellie, she wants to stop.
Ellie, are you there? I'm gonna walk out and
The surgery center's not letting me
guys.
document.
All right, that's fine. Okay.
Are we documenting now?
Yeah, but it's not letting me save it.